Coming to the next case scenario, a 12-year-old male suffering from systemic lupus erythematosus undergoes a hematopoietic stem cell transplant for a T-cell lymphoblastic lymphoma. The post-transplant course was complicated with graft versus host disease. This graft versus host disease involved the GI tract and the liver. Patient was treated with steroids, immunosuppressive agents, tyrosine kinase inhibitors, monoclonal antibodies, and alpha-1 antitrypsin. All this led to a highly immunocompromised state for the host. The patient develops fever. Again, blood culture sent grew Enterococcus faecalis and Streptococcus salivarius. Patient was treated with ampicillin and cefepime. Here, the source of infection is because of immunosuppression. The gut flora got translocated. Enterococcus is Enterococcus, a gut flora. It got translocated, which causes the bloodstream infection. On day 65 of transplant, post-transplant, patient again develops signs of sepsis. Blood culture sent. This time, the new pathogen is Escherichia coli. 6 out of 6 bottles Escherichia coli group. AST report showed some multi-drug resistant and an NDM producer. The patient was started immediately on ceftazidime avibactam azithromycin. The patient became afebrile. This was good news. But how far the good news lasted? Not long. On day 91, patient again develops fever. This day 91 is post-transplant. Patient again develops fever. Blood culture sent. Again, the same villain, Escherichia coli. AST report showing ceftazidime avibactam azithromycin. This drug is resistant by the shows resistant by the isolate. Hence, the patient was started on cefiderocol. Patient became afebrile. It was on day 91. In maximum span of 10 days, again the patient develops fever. Blood culture sent grew Escherichia coli. This time, the isolate is resistant to cefiderocol. Previously, first when the Escherichia coli grew, it was sensitive to ceftazidime avibactam azithromycin. So patient was started on that. Within a span of 10 days, the isolate developed resistant to ceftazidime avibactam azithromycin. Hence, the patient was on cefiderocol. Within a span of another 10 days, the same isolate proves to be resistant to cefiderocol. By nearly 101 days post-transplant, the condition slowly deteriorated. Patient became progressively acidotic, requiring escalating pressure support. The patient was maintained on tobramycin and polymyxin B. Condition deteriorated and the patient died of septic shock. Post-transplant, the patient survived for 105 days. So this is the slide prepared from CLSA document, 35th edition, M100, a recent, it came outside. The Tier 1, Tier 2, Tier 3, and Tier 4. Since the patient is from high-income country, the hospital and the patient was affordable for testing and for administration of Tier 3 and Tier 4 antibiotics. Everything was done at our end. Microbiology and the physician, ID physician have done their role, but the patient was unable to withstand the bat because of the immunosuppressed state. So this is a sample isolate showing isolate resistant to ceftazidime avibactam, ceftazidime tazobactam. It's a pan-drug resistant isolate, sample isolate, which is a pan-drug resistant. The first case is a real-life case scenario, which I saw in my fellowship period. The second case I have taken from the Clinical Infectious Disease Journal, published by IDSA. This is a case from a sequential treatment failure with azithromycin, ceftazidime avibactam, followed by cefiderocol, due to pre-existing and acquired mechanisms in a New Delhi methyl-beta-lactamase producing Escherichia coli, causing fatal bloodstream infection. Again, coming to our busy slide from WHO document, concentrate this time to concentrate on the fourth column. Escherichia coli is a carbapenem-resistant isolate. Mortality is medium to high. Anyway, our patient died. And the pipeline antibiotics, few promising pipeline antibiotics are there. Ceftazidime avibactam, azithromycin, cefiderocol. But how far they were efficacious in our case? Left to you to decide. The verdict of this chapter would be, in immunocompromised state, AMR makes the battle even harder. We need a different arsenal. When you're looking for a different arsenal, Fages will come as a good Samaritan.